Leave the stage. I'm going to invite up our next speaker. That's Ben Tongue, who is the Digital Net Zero lead for NHS England on digital sustainability, the new cyber ? So we're going to find out what NHS England are doing to embed greener by design as the latest cross-cutting digital design objective. Again, Ben is leading NHS England Transformation Directorate's digital sustainability, net zero and climate resilience agendas. He's a chartered environmentalist working across the NHS to drive all of that and has broad experience across a wide range of award-winning sustainability and environmental projects. Ben, over to you.
Thank you very much. Okay, hi everyone, lovely to be here. I'm just going to spend 20 or so minutes giving you a bit of a rundown of what we've achieved in NHS around the digital sustainability agenda over the last 5 years or so. So I lead a very small team trying to make a change in a big system. So we've got 1.5 million employees in the NHS. So that's obviously a massive challenge because it's very autonomous and spread out as well. There's tens of thousands of individual organisations that sit within that umbrella. So hopefully this will be of interest to you. I guess fundamentally I'm just kind of trying to fly the flag for some of the stuff that we've been doing, looking for collaborators, looking to give people ideas as well who are earlier in the journey. I certainly don't have all the answers, that's for sure. The new cyber. So just in terms of that, I guess we're on the cusp of a step change when it comes to digital sustainability in the NHS, and that's a much more mature digital management agenda. Obviously brings this risk focus in as well, which, you know, arguably now that we're in an unequal, conflict-ridden 1.75 degree world, perhaps we need to be taking more of a risk framing around the work that we're doing now to make it be seen much more as a kind of must-do activity rather than something which can be often bolt-on and still is a lot in my world, essentially can be opt-in when it all comes to the crunch. Here we go. So I've got rather a lot of stuff here. I'm going to whiz through it. It's a sharing deck. Just read the titles. The screen's too small really for it. But I'm just going to give you the narrative of what we've been up to. Anyone who wants to see the slides, I'm very happy to share them afterwards. So this is a couple of big picture bits to start with. So the first is the 10-year plan for the NHS. The government is head scratching a lot about funding all things public sector, including the NHS at the moment. There's big changes coming and we've got these three big pushes here. Analog to digital, obviously a digital thing, hospital to community and sickness to prevention. So, you know, you can see, I imagine, that digital runs through as a thread through all of those things. So this is core business to the NHS, and what we're trying to do is make greener or sustainability core business to how we do digital. It's a huge opportunity, and I'm sure this has come up earlier. I only arrived at midday, apologies, I was travelling from Leeds, so I may repeat some of the things that have been said earlier. But clearly this kind of global push around this topic is really timely, but also is super important. And some of the titles that are on here around leveraging digital technologies for climate action, resilient digital infrastructure, mitigating climate impact, etc., they're all the stuff that we're talking about, and the governments of the world are starting to align around them. So, but this is still a new topic to lots and lots of people. When I first started working on this topic, about 2019, I developed like a pub quiz session, which was really good actually in terms of getting people on board with it. And I stopped doing it, but recently I've come back to it again. I'm not going to do a quiz, but I will just like put on a few stats. Some of these you'll have seen before. 14% of global energy is predicted to go on digital. I do have references for all these. They're not all academic. You need to run your smartphone for 34 years to balance the amount of energy out of the wall with the manufacturing energy from How Bad Are Bananas? It's quite amazing, isn't it? A single Bitcoin transaction has the same carbon footprint as a transatlantic flight. 20 to 50 question conversation with ChatGPT uses a pint of water. By the mid-2030s, we'll all have a digital doppelganger in the cloud that uses as much water as we do, just to keep our personal data cool. The global data store is growing exponentially, and 90% of the world's data was created in the last 2 years. But most of the data does nothing useful, aka dark data. And estimates vary from 55 to 90%. So why do we bother keeping it with all the material and energy footprint? And then a little personal one, you can make a 96% energy saving from switching from a video call to audio only. Quite amazing as well. So like maybe we could start sharing some of these things. Some of those you'll have seen before, but I think these piffy little facts and stats, I'm sure we could argue about whether some of them are right or not, but they just get people pulled into talking about this and thinking about it. So maybe there's a bit of LinkedIn action to do or something like that, of sharing some of our favourite engagement stats. So now I'll just introduce a bit about the greener NHS approach. So we were the first health system in the world to create a cross-system climate management plan, I guess you could call it. Complete net zero target by 2045. We've got a slightly weird customised way of divvying it all up. We don't use the traditional scope system, but I won't go into that now. We also do the healthcare climate change adaptation stuff, and my team supports the system to create low carbon and climate change resilient digital health services, and we provide an assurance function within NHS England and a guidance function across the wider NHS at the moment. And we take this net benefit view, so we don't just look at the digital, but we look at what the digital does as well. But I know one of the big themes of today has been around the social elements of it and modern slavery and all that kind of stuff. So it's harder to make a net benefit argument around that, I think, because you can't say that it's okay to damage someone's life and well-being in another part of the world to get the benefit of using the digital in this country. So, but from a carbon perspective, you can make the argument to say that digital should create a saving, and that's what we look at. This is interesting, I think, probably. So this is the greener NHS supply chain roadmap, and this one I'm going to point at. I'm sure you can't read it, but this is, I think, the single most aspirational thing the greener NHS is trying to do, which is by April 2020 only buy products that have robust carbon footprints attached to them, which would be an absolute new world of scope 3 carbon footprinting and tracking and reporting and all of that kind of stuff. So watch this space, but if that comes out, that could create ripple effects even beyond the UK. It would be a global impact, I think. So that's really inspiring. Zooming in a little bit on our work, I'm not going to talk through this in detail, but just if you look at the left-hand column, over the last few years we've created assurance functions within NHS England that look at the business case and benefits process, service design, procurement activities, climate change risk management. We've created guidance to the system called What Good Looks Like that embeds sustainability stuff into digitisation, and we buy a load of stuff for the system as well in that last row that we can start to put much firmer criteria in as well. And to sit alongside this, we've developed, this is the intranet site that we've got, and we've got a load of tooling. So we've got a net carbon impact calculator, we've got low carbon design checklists, climate risk management, spreadsheets, and a bunch of hosting tooling as well on there for people to use. And then in terms of across the system, so the What Good Looks Like framework for good digitisation in the health system has a accompanying assessment, a digital maturity assessment, and we have a sustainability section in that. And you can see on that graph on the right, people are generally between 2 and 4. Reading out 4, there's a commitment to meeting net zero carbon, sustainability and resilience ambitions with an action plan in delivery, in addition to project management gateway assessments, engagement with the supply chain around impact of digital products and services. So it's quite robust. So you can see that of the 250 trusts which respond to this, we're starting to get some kind of good quality thinking around this topic now, which is really exciting. And now I'm going to just whiz through a few local activities that we've done. I'll keep cantering at speed, so hopefully leave a little bit of time for questions. So we're developing out these greener digital basics blueprints. So we've done a bunch of them, one around savings from power down, automatic power down, which is creating 500,000 savings per year in financial terms in one of the trusts. We've done stuff around circular approaches, sustainable web searching, and various other bits and pieces. Done some deep dives with looking at the relationship between FinOps and GreenOps, working with our digital FinOps professionals. We've done some trials of the Go Code Green stuff. Here, NHS 111 it was. It turned out, even though they'd not thought about this as a topic before, that they had one of the best ever ratings that Go Code Green had done, which was a nice surprise, and identified 34% further reduction savings that they could make. A nice little piece of work. And then we also tested last year the COSPRO, KA2 COSPRO software that plugs into ServiceNow and gives you granular carbon footprinting of your asset registers. We plugged in a bit of clinical devising into that as well. And we found that when you looked at the product level stuff, there was about, I think it was 64% increase on the government tools that are used as standard for carbon footprinting tech. So quite a big difference. But the most hot off the press, and the one I'll zoom in on a little bit, is Wayfinder. So this is part of the NHS app, and it's functionality in the app which allows people to go in and book and change appointments in the app, which is quite revolutionary, even though it doesn't sound like it. And we've done a bit of a deep dive with them about looking at a few things. So first of all, we looked at how they architected their solution for sustainability, their technical solution. We helped them think more deeply about their carbon benefits, and then we did a look at a proper analysis on their paper switch over to digital. So this is a bit indicative of the work that we did on the architecting for sustainability stuff. So we tested it against the AWS well-architected sustainability framework, and this is a subset of some of the stuff that's come out here. Green is they're doing it, orange is they could do it, red is they can't do it because of a technical reason. So this kind of deep engagement's really obviously important to get into. We also looked at their benefits and identified these numbers, which will be a bit meaningless, some of them in isolation. But it's starting to try and get beyond this conversation of, in my world anyway, people just talk about travel savings and paper, how much paper you didn't buy as the benefits of digitisation. And there's so much more to it than that. So one of the things that we did with this piece of work was look at a full boundary analysis of the old paper process, which was 3 letters and a phone call to change an appointment, versus doing it on your phone, and looked at the full digital bit, the full paper bit, and identified a 92% per transaction carbon benefit, which scales up to another meaningless number, 20 kilotons of carbon annually, which is like 0.1% of the NHS's carbon footprint, but is made statistically significant in terms of the analysts who are looking at it. This is good because it starts to ask the proper conversation around a full boundary analysis. Other little bits and bobs that I can talk about with people who are interested is we looked at virtual wards. So there's been a big push across the NHS to allow people to be treated in home rather than in a hospital, and there's a methodology now for how to carbon footprint virtual wards, and we got a load of digital stuff into it, and there's a load of case studies out there around how much carbon that's saved. And then just to this point about the carbon benefits a bit more deeply, this is a digital preoperative assessment provider, and with them I did a couple of hour workshop with them to try and think about how they can create a deeper carbon narrative around their product. So looked at things like making surgery more efficient, less cancellations, reducing duplications of appointment, briefer consultations, these kind of things. So starting to try and really get under the bonnet a bit more about the carbon benefits of digitisation is something that you have to spend a lot of time on, but I think then we can start to really unpick, you know, is it worth getting all this new tech to do a thing or not? Because you're starting to look much more systematically at the benefits that you're creating. But there's the other side of the climate coin too. So climate change. We have in the public sector Green Book requirements to say that we should be making sure our projects are resilient to a 2-degree world. But what does that mean for digital is a really, really difficult question, and it's one that I'm working very hard at the moment to try and get a view on. So just as a way of very brief introduction, there's some stuff here, sector briefings from UK Climate, that look at some of the direct risks to health and social care and telecoms and ICT. But the fundamental question here is how can we make sure that we can rely on our digital in a climate changed world? How can digital be part of the resilience solution? And that's what we're trying to kind of unpick a bit. So there's been some key preparation for this in terms of the cross-government energy outages work that's been happening. The government's been testing it. The UK Climate Change Commission, that purple box, highlighted energy security as one of the key short-term risks. So there's loads to learn here from this, hundreds and hundreds of people that have been pulled into this preparation programme. We also had, serendipitously, a really lucky event happen for us in the 40-degree heat wave in 2022, because the data centre outages at Guy's and St Thomas's due to the heat wave have really created a door-opening moment for conversations like this with our digital leaders. So, and actually, I would possibly argue that climate resilience is a good entry point with digital leaders rather than carbon reduction, because it's like a now issue, and it's a part of the digital language already, resilience. So it's a new thing to be resilient against, whereas the decarbonisation agenda can often be seen as like a new thing that you have to do that you haven't really got time for. So this was very, very useful. But this is complicated because we're thinking about all of these things within the system boundary. This is my daughter's felt tip pens. But basically you have to think about this data flow or chain of connectivity, and also all the dependencies that you've got on it. And so we're currently doing some work with Transform UK using their system thinking model. If you're interested, you could Google that, Tools for Climate Policy 2 Systems Mapping. It's a government blog looking at how they use their system thinking approach with DESNES, with the Net Zero Challenge. And so we're currently in a really divergent phase of thinking with them at the moment, trying to understand how all of the stakeholders or actors within the system that we rely on for our digital services to function are interacting with each other, and where are the likely points of failure in terms of climate risk, and what are the risk mitigations that we should be looking at. And we want to boil all that back down into a really punchy set of 10 or 20 measures that we can advise into climate change risk assessment processes when people have identified that climate-driven digital failure is a likely problem. So that's that. Right, last section virtually. We are getting onto a cusp of a new world now. So we've got this opportunity to bake in, actually I might start with this slide, bake in greener by design, or sustainable by design as it's written here, into all of the mandated things that digital's got to do to sit alongside cyber, accessibility, information governance, all those other things that are more mature in terms of digital design objectives. And we're currently in the foothills of setting a new set of requirements for what this might look like. So an obvious one is cyber itself. In the NHS, there's an information standard, and the centre funds all the providers to meet it, to make sure that our services are secure. But we've also got analogous things in terms of, in the greener world, a net zero building standard. So, you know, we're not walking a new path here. There are other sections of the sustainability profession that are further ahead with it, and how can we kind of catch up is the really important thing. But also, how can we keep up with all of this amazing emerging work that's happening out there in the big wide world? And this is just a snapshot of some of the stuff that's out there. So it really is a balancing act, because we've got so many providers in the NHS who haven't even started thinking about this yet. But also we've got all of this amazing stuff. So how do you kind of find the middle point where you're kind of starting people on the journey, but not giving them a set of requirements that are just going to make their head explode when they start to look at it? And that's the kind of tightrope that we're trying to walk at the moment, and working with various people in the room on it as well. I think it's just worth noting as well this kind of potential tensions and synergies between some different design objectives. So I've used the tech coded practice here, but I could use this one here. So where might you see tensions and synergies between these? So an obvious example of some synergies are you get financial savings from green digitisations. Websites should be more accessible. If you keep less data, you should have less cyber risk, all of this stuff. But maybe if you want to have mirrored data centres, so you've got resilience in your service delivery, that's obviously got a tension against carbon reduction. And very often our core service delivery, i.e. healthcare in my case, will have a tension against some of the green aspects as well. How do you balance some of this off is a question that we're going to have to start to get our heads around a bit. And also, how do we start to really get into what people are thinking about centrally as well? So there's a real big push in the health system around productivity at the moment. And so we've thought up a methodology about how we can start to carbon quantify productivity improvements to try and really speak the leaders' language and get into the mix with, you know, what they're thinking at the big table. I hope that's where we've got to really. And I was annoyed I couldn't get here for the one gov.uk one login presentation this morning, because the missing piece for us really is about how to start to build this culture change around this topic. I mean, again, sorry, it's a bit dark, but you know, there's loads that we still need to do around resourcing, around skills, around funding, around leadership buy-in, awareness raising and assurance, to really be able to get to the place where we've got a mature green design objective around this. Also, but people get it, they understand what they've got to do, and they understand why they've got to do it, and it's just not seen as a hassle and a new thing that they do. Because fundamentally, I think, generally speaking, people on average want to do something around this agenda now. It's about making it easy for them to do the right thing in the small amount of time they've got stuff to do off the side of their desk each week. So, yeah. I think I'll finish there. I hope that was interesting.
Thank you very much, Ben. I will take one very quick question, one sentence question. Who would like to ask it? Go on, someone right there.
Thanks for the presentation. I just had a quick question to ask. Is there any lesson that you've learned from the work you've done so far that you can share?
Yeah, absolutely. Yeah. Now, I mean, this goes to anyone in the room. I'm very happy to have like a chat afterwards to find any of the things that we've tried and done successfully or not successfully as it may be, to kind of give you all the lessons learned reports about it. Those blueprint case studies that I talked about as well, they're very much lessons learned case studies, warts and all. They're all about spreading good practice, good digitisation practice across the whole NHS, including what didn't work, so other people don't have to make the same mistakes. But if you want to have a full chat, then do reach out on LinkedIn and we can connect.
Ben, thank you very much.
Yeah, thanks.